Hi everyone, Dr. Haider Ali here, pulmonologist. We're going to talk today about oxygen therapy, something that's very, very important, crucial for all of us to live. And we're really going to go through the basics. We're going to talk about why do we need oxygen. We're going to talk about the indications, when is it prescribed. We'll talk a little bit about the equipment, like the tanks, the concentrators, the portable concentrators. We're going to go into safety, talking about fire risks and home tips. And then we'll talk about travel if you want to get out and about with your oxygen. And we'll also look at the science behind it and why we use oxygen at all. And finally, we're going to finish up with some myths. We're going to dispel some myths about oxygen. So really, let's get back to basics, right? So how do we breathe? The whole reason we breathe is to take oxygen into the body. And our lungs are like sponges made of millions of little tiny air sacs called alveoli. And what happens at those alveoli is gas exchange. So oxygen enters the bloodstream to fuel the body, all your muscles and your organs. And then carbon dioxide leaves the blood to be exhaled. So you breathe that out. What happens in lung disease is this exchange is somehow blocked or it's inefficient. So you're not able to get enough oxygen in, or you can't get the carbon dioxide out. Hypoxemia is a term we use in medicine frequently, and it means low blood oxygen level. And this is quite dangerous because when your blood oxygen level is low, your vital organs around the body are not getting enough the fuel they need to do all the things the cells need to do. And so as a result, your body has to work a lot harder. So your heart is pumping faster and harder to deliver the limited oxygen it has. Your brain may feel foggy or confused or tired. And you may fatigue very quickly when you're walking around. You may find it really difficult. Your legs will get tired. You may get dizzy. You may just need to take a rest very quickly. So that's why oxygen is so, so crucial to everything we do. How do we measure oxygen? So some of you may have something called a pulse oximeter, which is like a little device that you put on your finger. And this is almost like a little finger clip, and it uses light waves to estimate the oxygen in your blood. The great thing about it is it's very fast, it's painless, it's very easy to use at home or in the hospital. Um, the things you should be aware of is it can be inaccurate. So when your oxygen levels are very low, it becomes inaccurate. It can also be inaccurate if your fingers are cold. It may not get a good signal, or if you have, if you're wearing nail polish or you're wearing sort of synthetic nails. So those are things to keep in mind. If you are seeing really bizarre results, it could be there's something else going on there. But the most detailed way that we check oxygen, especially in the hospital, is with something called an arterial blood gas, which is where we will actually put a needle into your artery to get blood. Now that's the most accurate way, but it's obviously quite painful and it's very inconvenient. We only do that in very specific circumstances. So what are the magic numbers? Like, when is oxygen prescribed? And it's fairly simple actually. So according to most insurances will allow us to prescribe oxygen if your oxygen saturation, which is your finger clip number, when you're just sat down at rest doing nothing, if your oxygen levels are 88% or lower, you qualify for oxygen. Because we know that once your blood oxygen goes below 88%, you're not going to feel good. And we know it's going to put too much of a strain on your heart over a long period of time. Now, there are certain situations where we can get oxygen for you if your oxygen levels are 89. And that's a very specific scenario depending on what your heart looks like as well. Now, the other way we can get oxygen is that if your oxygen levels are fine when you're sat down or just doing nothing, watching TV or reading a book, but as soon as you get up to walk around, they fall below 88. But when you stop, they may recover back up. You still qualify for oxygen at that point. So those are the two main scenarios that we prescribe oxygen. So what are some common myths I hear about oxygen? Well, a common one I hear is it's addictive. And this is actually false. Oxygen is not a drug you can get addicted to. Your body needs it to survive, just like water. If you need it, you need it. The other myth I hear quite frequently is, well, if I get oxygen, if I start using it all the time, my lungs will just get weaker. They'll just become dependent on the oxygen. And again, that's false. Using oxygen does not shut down your lungs. It simply helps your organs get the fuel that they're missing. The other thing I want to mention here is that a lot of people think that if they feel breathless when they walk or do something, it means their oxygen levels are low. And that's not the case, not always the case anyway. There are many people who are very breathless, and it is because their oxygen levels fall, but it is possible to feel breathless and have normal oxygen levels. And that's for a variety of reasons related to your lungs, your airways, your heart. So let's talk about oxygen equipment, because there's a few things that some of you may be aware of or may even have these at home. So the real workhorse of oxygen therapy is a stationary concentrator. This is a sort of fairly large box that's about the size of maybe a humidifier or a purifier at home. It plugs into the wall, and what it does is it draws air in from the room and it filters out all the nitrogen, because most of the air is nitrogen, and it creates very concentrated medical grade oxygen, about 9, so you're breathing in about 90 to 95% oxygen. Whereas now I'm just breathing in 21% oxygen. So it really makes a very concentrated oxygen form. The pros are that it's an unlimited supply, right? As long as you've got electricity, your machine will just churn the air into pure oxygen. You don't need to refill it. It's very cost effective. The downsides, obviously, is that it requires electricity, and so there may be concerns. If you have a power outage, for example, it's not portable. It's quite a big machine and it's quite heavy as well. And some people complain that it can generate some heat and noise, but by and large, these machines really are very, very important for anyone who needs oxygen. So next are the tanks. Now, many of you probably have compressed gas tanks. They're usually silver and green. And the way these work is that a company has taken oxygen and compressed it into under very high pressure into these metal cylinders. And so they come in a variety of sizes from about this big all the way to huge sort of floor standing things. The great thing about these, it's pure oxygen. You're getting, close to 100% oxygen. They're very silent. They don't need any electricity. So they're great to have in reserve if you have a power outage. Now, the downside is obviously they have a finite supply. They run out, right? You need refills. The small tanks will run out very, very quickly. And the rate at which it will run out will depend on how much oxygen you use, right? So some people take 1 or 2 liters per minute. Other people need 6 or more liters per minute. And so the higher the flow rate, the quicker these things will run out. The other problem is that they're very heavy. Many of you probably have experienced this, but you either have to carry them on your shoulder or wheel them around, but they're quite cumbersome. And if you're already having breathing issues, they can be quite hard. Now, the alternative to tanks is something that I get asked a lot about, and we try and get these for patients where we can, and these are portable oxygen concentrators. So before I told you about the stationary oxygen concentrator, which is the large one that goes in your house. Now, these are small machines. They're probably about the size of a shoebox sometimes, or even smaller. And these are battery operated, they're rechargeable, and it means you can have oxygen on the go. It can weigh anywhere from 3-4 pounds up to 20 pounds. They're pretty varied in their size and weight. The crucial distinction is that whereas a tank and your big concentrator is giving you a continuous flow of oxygen, these portable ones are just giving you a pulsed flow. So they're just giving you a little burst of oxygen with every breath. The reason they do this is to save battery capacity, because if they gave you continuous flow, the battery would die very, very quickly. So they are very good. They can be expensive, especially if your insurance doesn't cover it. And obviously over time, the battery will degrade, but you can get spare batteries. But overall, these can be a lifesaver for people who want to get out and travel, especially if you want to get on a plane as well. You can't travel with a tank on a plane, so you have to either rent or buy one of these. Now, oxygen is flammable. Now, oxygen by itself doesn't explode, but it can make everything else burn much faster and much hotter. So it's really, really important you don't smoke, including e-cigarettes, when you're on oxygen. You need to stay at least 5 to 10 feet away from open flames. So that means gas stoves, candles, fireplaces. If you are cooking over a gas stove, you really do not want to be wearing your oxygen at that time. So there is definitely a risk, and we have seen patients who have smoked with oxygen and unfortunately had burns on their face. So it is a very real problem. So traveling with oxygen, how do we do this? So you can travel, but it does require planning. So if you're going in a car, You really want to make sure that the tanks are secured if you're taking tanks. You want to keep the windows slightly cracked. Obviously, don't smoke in the car. And we want to make sure that the temperature of the cabin of the car isn't going to get very hot if you're not in there. If you're going on an aeroplane, you need to take an FAA approved portable concentrator. You cannot take a tank on a plane. And if you are planning to fly, you need to speak to that airline and they can send you a form which you get filled out by your physician. And you can either, they can either you can rent one from the airline, or if you have one, we just have to specify that it is safe to take it on the plane. Now, if you're going on a cruise, you have to arrange with the cruise liner months in advance, because they'll often have oxygen vendors that they use that will specifically deliver to the ship. So make sure you stay ahead of that and you're organized about that. Okay, guys, hopefully this has been very useful for those of you either considering oxygen or maybe close to requiring oxygen, or those who may experience low oxygen levels. Or hopefully this was a good refresher and a bit more information for those of you who are already on oxygen therapy. So hopefully you find this useful, and we'll see you next time. Thank you.